The medical community can be quite slow to change. So one example of this is hand washing. Back in the 18th and 19th century, there was an epidemic of childbed fever. This is where moms got infections after giving delivery. So there was a doctor at Vienna General Hospital who was responsible for the maternity ward. And what he found was that there were high rates of this puerperal fever in the women who were delivered by the medical students. But interestingly, the women delivered by the midwives had much lower rates of this infection. So he hypothesized, is it possible that because the medical students were doing exams of cadavers, they were actually dissecting human bodies prior to delivering the moms, could it be that they were transferring some sort of decaying or decomposing matter from these corpses directly into the woman? And so he instituted this hand washing policy, and he found that after the hand washing policy was instituted, the rates of this puerperal infection was much lower in the patients delivered by the medical students. And so he tried spreading this information nationwide, letting all the other doctors know about it, but unfortunately they thought he was nuts. This was all before the germ theory of disease that Louis Pasteur had developed. And so they thought Dr. Semmelweis was crazy. They were like, what are you talking about? There's no way this is happening. And so he went on trying to explain what was going on to other physicians, but they didn't believe him. Why do I tell this story? So sometimes it feels like with ketamine infusions that there's a lot of doctors who don't believe in the evidence. And we have randomized double-blinded controlled trials showing the effectiveness of it. But we must understand that the medical community is slow to change. And even if there is scientific data, still sometimes that doesn't do the job. And it's going to take time, it's going to take more evidence, and it's going to take patient stories. So if you or anyone you know has benefited from ketamine, or you're just curious about learning more, please share this video. Let your doctor know, let your psychiatrist know, let your counselor know about this possibility and help spread the word, and we can definitely make a difference. If you have any questions or comments, please leave me a message below.